Okay, so the global inequality in Mexico is actually pretty different from what I had thought of it at first. I briefly knew about it, and from what I learned, it actually kind of changed my perspective. In the book, it states that global inequality refers to systematic differences in wealth and power that exist among countries. And there's a graph about global inequality among the different income countries. So Mexico would be like in the upper middle, so the green part. And for example, I wanted to do a comparison to South Africa, for example. So they would be like in the red. So the lower middle, the lower income countries. For example, the gross national income per capita would be like $588, as compared to a country like Mexico, which would be like $6,977. One thing I noticed is that people have more babies and they reproduce more in lower income countries than they do in upper and middle income countries. So that leads to their life expectancy. In lower income countries, their life expectancy at birth is 62 years. And in upper middle countries, it is 74. So those are like more years they're able to live based on their health care and their nutrition. So obviously, if low income countries are producing a lot and they have a lot of children, but their income is really low, that causes them to not have enough money for healthcare or like good foods. And for upper middle countries, they have less children and they have more money to be providing for them, so they have more chances of being healthier and having more time to live. Also, their infant mortality rate in lower countries is 56 per 1,000, and compared to countries like Mexico is 16 per 1,000. So that's a really big difference. There's also another graph right here that shows the countries, and Mexico is located right here, and their income in 2012 was around 4,806 to 12,615. Their health and their malnutrition. First, I want to talk about the health. So the health is, from my experience, when I went to Mexico, I didn't think that the poor had that many advantages of going to get health care or going to get their, physical checkups. But there's actually really economic, like, healthcare, or like places that you can go to get checked up. There's there's a place. It's like really for like rural villages, and you can go and get checked for like about 60 pesos. That's like about $7 or something like around that. And so it's really cheap, and it's not the best quality of health, but like all the nurses are certified, and like they give you some type of medicine, and it's very like for the people who don't have that much money. And for people who do have more money in Mexico, of course they have all the advantages to go to a hospital or to a doctor's office and stuff like that, but their health isn't as bad as it would be in a lower country. Their hunger, malnutrition, and famine, it's really not that bad. Like I said, the poor aren't really, going through that much malnutrition. There's a question in the book that says, can poor countries become rich? And from what I have seen, Mexico, of how it started off and to where it is now, I think that it can not necessarily become rich. And because of course that would take a lot of time, just like the United States has developed greatly since it was first discovered. But it has slightly been increasing. You know, the economy of Mexico has like been becoming better, and I don't believe maybe they can become rich, but they are progressing. They are progressing, and like I said, in their health especially. And so I think that's it. So that's overall what I believe about the global inequality in Mexico. And yeah.